Asthma is the most common chronic illness among children. It can even be life-threatening. Anyone can be diagnosed with asthma at any age. Often, asthma starts in childhood. People who have allergies or a family history of allergies are more likely than people without allergies to have asthma. Asthma runs in families. If you, your spouse, or your parents have asthma, your children are at an increased risk for the disease. Additionally, people who smoke or who are around a lot of secondhand smoke are more likely to get asthma. Over 25 million Americans have asthma, which means 1 in 12 people have asthma. This number continues to grow each year. Even as the numbers grow, the ability to treat and control asthma improves. By working with your child's healthcare providers, you can control your child's asthma, prevent asthma flare-ups, and intervene early when an asthma flare-up occurs. The care process for your child starts by knowing the asthma symptoms. Then you can work on avoiding triggers, taking medications regularly, following an asthma action plan, and monitoring asthma control weekly. Asthma is a lifelong chronic lung disease that makes it more difficult for your child to breathe. Symptoms include wheezing, coughing, increased work of breathing, breathlessness, and chest tightness or pain. With treatment, your child can control the disease and live an active full life. The relatively rapid onset or progression of asthma symptoms is called an asthma attack or asthma flare-up. There are 3 main characteristics of an asthma flare-up. During an asthma flare-up, the inside lining of the airways swell, narrowing the space inside the airways and reducing the amount of air that can get through. The muscles surrounding the airway become tight. This is known as bronchospasm. More mucus is produced in the airways, narrowing them even more. Symptoms of an asthma flare-up can include wheezing when breathing in and out, increased coughing, chest tightness, a feeling like you can't get air out of the lungs, behavior changes such as tiredness or irritability, not performing usual activities, and awakening more at night or earlier in the morning. When your child starts to feel unwell, it will be helpful to have a method of tracking his or her asthma symptoms, such as an asthma symptom diary. Then, take the symptom diary with you to your child's next primary care provider visit. Remember that a trigger is something that can trigger or cause an asthma flare-up. You can record possible asthma triggers in an asthma symptom diary as well. One step in controlling asthma is identifying your child's trigger and avoiding those triggers. While this may require a lifestyle change, the benefits far outweigh the inconvenience. The first category of triggers is allergens. Allergens are substances that your child's immune system may be sensitive to. Allergens can be found indoors and outdoors, or your child may ingest or eat them. An allergist can conduct allergy tests that will identify common allergens, making it easier for you to avoid your child's triggers. Americans spend up to 90% of their time indoors. During that time, your child is exposed to indoor allergens, which include dust mites, pet hair and dander, molds, and cockroaches, among others. You can reduce exposure to these triggers in your home by keeping your home dry, well ventilated, and free from pests and contaminants. Dust mites are tiny insects, too small to see, that feed on human skin flakes. Body parts and feces from dust mites are found on fabric-covered items in every home. To reduce dust mite exposure, wash bed linens and stuffed toys at least once a week in hot water at 130 degrees. Put airtight covers around mattresses, box springs, pillows, and comforters. Wipe furniture with a damp cloth monthly. Place filter covers over the heater vents. Replace upholstered furniture with wood, leather, or vinyl furniture when possible. Use a vacuum with a HEPA filter and, if you have carpet, consider replacing it with a hard surface material such as wood, laminate, or tile. These materials are much easier to keep clean of allergens. Molds grow in warm, dark, and damp places such as bathrooms, closets, basements, and behind wallpaper. To reduce indoor mold exposure, clean mold-prone areas with a bleach cleaner on a regular basis. Limit the number of houseplants. Shake excess water off of shower curtains. Avoid letting water collect in dish drainers and plant trays. Repair water-damaged areas such as wallboard and tile grout. Avoid using a swamp cooler or humidifier, and use central air conditioning to cool your home. Cockroaches and other pests leave droppings, body parts, and saliva. These items are allergens that can cause allergic reactions or trigger asthma symptoms. To reduce exposure to these allergens, keep food covered and out of bedrooms. Clean up all food crumbs or spilled liquids immediately. Keep counters, sinks, tables, and floors clean. Clear clutter and other hiding places that attract these pests, and seal cracks or openings around or inside cabinets. Pets can be a main carrier of allergen triggers. If you have a pet, it may be necessary for the pet to live outdoors or find a new home. At a minimum, keep the pet out of your child's bedroom. Wash your child's hands after handling pets at home, at the fair, or petting zoo. If you keep your home safe and well maintained, there will be fewer allergens to bother your child. Outdoor allergens include pollen, mold, and mildew. Avoid outdoor allergens by staying inside during high pollen count days. Take care to keep windows closed at home and in the car. Use an allergen-grade air filter in your furnace and central air conditioning system. Eggs, milk, soy, fish, corn, and peanuts are common ingested allergens. Food or drinks processed with sulfites or that contain sulfites, such as dried fruits, fruit juices, and shellfish, may also trigger asthma symptoms. Avoid foods containing these products by reading the labels. Always check food labels, as ingredients may change without notice. The air we breathe, both indoors and out, contains pollutants that can irritate your child's lungs, causing asthma symptoms. Common irritants include tobacco smoke, smoke from fires or campfires, smog, fragrances, aerosol sprays, and fumes from household products. Avoiding irritants may require a lifestyle change as you consider what items to bring into your home. If you smoke, seriously consider enrolling in a smoking cessation program, as cigarette smoke is one of the worst airborne irritants. Sudden blasts of cold air, heat, humidity, or very dry air may trigger asthma symptoms. If your child reacts to changes in the weather, have him or her wear a scarf over the nose and mouth. Your child needs to breathe in through the nose. If heat or humidity triggers asthma symptoms, use central air conditioning and drink plenty of water. Stress or strong emotions may also trigger asthma symptoms. Stressful situations that affect children include divorce, a death in the family, and the start of a new school year. Talk to your child. Find out how they are feeling about school, friends, or family. Colds, the flu, sinus infections, and other illnesses can trigger an asthma flare-up. Symptoms from these illnesses tend to last longer if your child has asthma. To reduce infections, establish a healthy diet for your child, exercise regularly, practice infection avoidance measures, and get plenty of sleep. Your child should get an annual flu shot. Avoidance can include practicing good hand hygiene with soap and water washing and/or hand sanitizer, along with regular cleaning of doorknobs, faucet handles, and other shared surfaces in your home to prevent the spread of germs. While exercise can trigger an asthma flare-up, it is important for asthma patients to remain active. Regular exercise strengthens the heart and lungs, it is good for bone strength, and it helps maintain a healthy lifestyle and normal weight. If exercise is a trigger for your child, your physician will provide instructions on using a quick relief medication before strenuous activity. Note that while swimming is an excellent activity, the fumes from chlorine in indoor pools may trigger asthma symptoms and require using a quick relief medication before swimming. If you can't identify your child's triggers, keep an asthma symptom diary as symptoms occur. Keep track of the following: where your child was, school, home, outside, extracurricular activity, what your child was doing, playing with a pet, exercising, cleaning? When it happened? At night? After eating? During or after exercise? When stressed or excited? As you maintain your child's history record, you will begin to notice patterns that will help you identify your child's triggers. Medication is a key component to controlling asthma. Your child will use different types of asthma medications: daily controllers, quick relievers, and short burst medications. Daily controllers are used every day to prevent asthma flare-ups regardless of your child's symptoms. If your child is feeling great, you may be tempted to stop giving the daily controller. Remember that one of the reasons your child feels great is that the daily controller is working to prevent the inflammation you can't see. Most daily controllers target reducing airway inflammation in the breathing tubes, which prevents other symptoms from appearing, such as cough, wheezing, mucus, and chest tightness. There are potential side effects from daily controller use, but the benefits can be worth the effort to reduce or eliminate the side effects. For example, many daily controllers are inhaled steroids. They are safe to use on a daily basis, but a known side effect is development of a yeast infection in the mouth known as thrush. Your child can avoid thrush by rinsing his or her mouth after each use. Quick relief medications are used on an as-needed basis to relieve symptoms from an asthma flare-up by relaxing the muscles around the breathing tubes. During a bad asthma flare-up, it may be necessary to use a quick relief medication several times a day. If your child regularly uses quick relief medications more than 2 times per week, his or her asthma is not in good control. You need to consult with your child's physician to modify treatment with controller medications. Albuterol is the most common quick relief medication. Short burst medications are steroid liquid or pills given by mouth in a burst, usually over 3 to 5 days. They are used early for a bad asthma flare-up to prevent your child from getting worse and needing to go to the hospital. Your doctor may use an asthma action plan that is personalized to your child's asthma to help you use medications properly. The asthma action plan includes details about when or how to use controllers, quick relievers, or burst medications. We will talk about this more in a few minutes. If you have concerns about affording medications for your child, you may learn more about prescription assistance at www.health.utah.gov/asthma. Most asthma medications are delivered straight to the lungs with the help of a delivery device. There are several types of delivery devices. A metered dose inhaler, also known as an MDI, delivers the medication as a spray. For the medication to be effective, the device must be used correctly. For example, your child may be prescribed more than 1 dose or spray of inhaled medication. If so, your child needs to wait 30 to 60 seconds between doses. We will talk about this more in a moment. You'll also need to track dosages used from an MDI. The canister is pressurized, making it difficult, if not impossible, to tell how much medication remains. Some MDIs have a gauge that tells the user how much medication is left in the canister. Other canisters do not have a tracking tool. Since the canister tells you how many sprays are available in a full MDI, the easiest tracking method is to mark the canister with an ultrafine tip permanent marker each time it is used. You can then subtract the tracking tally to calculate how many sprays remain. An MDI should be used with a spacer or holding chamber. Spacers have either a mouthpiece or a face mask. A spacer with a mouthpiece or face mask greatly increases the effectiveness of delivering the medication to your child's lungs. The steps for using a mouthpiece spacer are: 1. Remove the cap from the inhaler and spacer if necessary. 2. Prime the inhaler if it is a new canister or has not been used for 1 month. 3. Insert the inhaler into the rubber end of the spacer. 4. Shake the inhaler before each puff or spray to mix and warm the medication. 5. Breathe out. 6. Place the mouthpiece fully into the mouth, between the teeth, holding the inhaler upright and closing the lips around the mouthpiece. 7. Press the canister down to release a puff of medication. 8. Breathe in deeply and slowly for 3 to 5 seconds through the mouth. 9. Hold your breath for 10 seconds. 10. Remove the spacer from your mouth and breathe out slowly. 11. After 30 to 60 seconds, repeat steps 4 through 10 for each puff prescribed by your child's doctor. Remember to have your child rinse or brush his or her teeth after using an inhaled steroid. The spacer with a face mask works just like the mouthpiece, only it's more appropriate for small children who haven't mastered using the mouthpiece device. The steps for using a face mask spacer are: 1. Remove the cap from the inhaler and spacer if necessary. Prime the inhaler if it is a new canister or has not been used for 1 month. 3. Insert the inhaler in the rubber end of the spacer. 4. Shake the inhaler before each puff to mix and warm the medication. 5. Breathe out. 6. Place the mask over your child's mouth and nose with the inhaler upright. Maintain the seal between the face and the mask. 7. Press the canister down to release a puff of medication. 8. Encourage the child to breathe in deeply and slowly for 3 to 5 seconds through the mouth. 9. Maintain the seal for 5 breaths while the child breathes in and out, then remove the mask from the face. 10. After 30 to 60 seconds, repeat steps 4 through 9 for each puff prescribed by your child's doctor. Remember to have your child rinse or brush his or her teeth after using an inhaled steroid. A nebulizer is a machine that turns asthma medication into a fine mist that your child can easily breathe into his or her lungs. Your child's doctor may prescribe a nebulizer if your child is very young or struggles using an MDI and a spacer. However, a properly used MDI and spacer can do an equivalent job of delivering medication to the lungs. Read the instructions for the nebulizer. Proper usage varies slightly from devices made by different manufacturers. Take care to make sure you put the medication in the correct compartment. If you have questions on how to use your nebulizer, contact your doctor or asthma educator. Dry powdered inhalers are another type of asthma medication. This medication can be used with older children, either combined with another medication or as step-up medication therapy for difficult-to-control asthma. After your child is diagnosed with asthma, your doctor will develop an asthma action plan. An asthma action plan is a daily guide to living with asthma. The plan is divided into 3 sections: Go, Caution, and Stop. In the Go section, your child's asthma is considered well controlled. Essentially, your child will be using a daily controller medication only. He or she will show no symptoms and use a quick relief medication only before exercise or exposure to a known trigger. Any additional need for a quick relief medication for symptom control means the asthma is no longer being well controlled. If your child's asthma stays well controlled, it is recommended that you make regular appointments with your healthcare provider every 6 to 12 months or as directed to check up on your child's health. This visit may include pulmonary function tests, also known as PFTs. It is recommended that this test be done at the time of diagnosis if your child is old enough, when controller medications are first established, then every 2 years to monitor lung function. In the caution section, asthma symptoms are getting worse. In this section, your child will be experiencing symptoms and will likely be using quick relief medications and having some limitations in activity level. Your asthma action plan will specify what to do and may include increases in quick relief medication, advice about visiting your provider, and even advice about starting short burst medications. The medication changes should help your child move back to the Go section. Sometimes these changes don't help and your child stays in the caution section or moves to the stop section. The asthma action plan will have further instructions on what to do if either of these happen. Stop is the last section. There may be additional instructions regarding medication use, particularly quick relief medications and burst medications. The stop section, however, usually means your child is not getting any relief from the medication and you will need to seek immediate medical attention. This includes going to the nearest emergency room. This is an urgent situation. Your child may need oxygen or oral steroids as well as frequent quick relief medications. Your child may need to be hospitalized. Following the action plan will help you know how well your child is doing. You will be able to decide how to use quick relief medications, when to step up care, and what symptoms should be reported to your child's physician or prompt immediate visit to a medical provider. While following the asthma action plan, you can more closely monitor your child's chronic asthma control using the Asthma Symptom Tracker. This involves taking an asthma control test weekly to gauge your child's health status and charting your child's score on a graph. The control test contains 5 questions. 1. How much of the time did your asthma keep you from getting as much done at home, work, or school? 2. How often have you had shortness of breath? 3. How often did your asthma symptoms, wheezing, coughing, shortness of breath, chest tightness, or pain, wake you up at night or earlier than usual in the morning? 4. How often have you used your quick relief inhaler or nebulizer medication such as albuterol, Ventolin, Proventil, or Max Air? 5. How would you rate your asthma control? You should track the asthma control test results weekly, plot them on a graph, and bring them with you to your child's scheduled or unscheduled doctor's appointments. Your doctor will be able to identify any notable trends from the asthma control test that need to be discussed. Asthma controller medications will be modified as needed. Your healthcare provider may use the term ICE to review your child's asthma care. ICE stands for Inhaler Technique, Compliance, which is the number of days your child has taken medication during the past week, and Environmental Control and Trigger Management. Controlling your child's asthma is a continuous process. It may feel overwhelming when contemplating all the new things you need to keep track of. Following a few basic steps will keep you and your child on a healthy path. Become familiar with asthma symptoms and watch for symptoms to appear. The symptoms will appear when your child is exposed to triggers or your child is not taking needed medications. Avoiding triggers and taking medications as prescribed by your child's physician is key to staying healthy. Remember that asthma cannot be cured, but it can be controlled. If your child is feeling well while taking his or her asthma medications, it means the medications are working. Only change medications under the advice of your child's physician. Your child's asthma action plan will help you recognize when symptoms appear, step up care as needed, and help you know when to seek medical attention. Follow this plan as outlined by your child's physician. If at any point you have questions about controlling your child's asthma, contact your child's physician or asthma educator. They are here to help you.